welcome. You are listening to another episode of the Business of Aesthetics podcast series, brought to you by our gold sponsors, MRP, Laser Uptech, and Equa Marketing. We also want to thank our silver sponsors, Lendia Law, Eilis Works, and Pronox. If you would like to network and share your experience with our podcast guests and other aesthetic industry professionals, join our Facebook or LinkedIn communities by searching for Business of Aesthetics. Today we're going to be speaking with one of the finest experts in aesthetics.
Get ready for an extraordinary opportunity. You're invited to join our exclusive monthly webinar, brought to you by the Aesthetic Institute and the Business of Aesthetics community. Don't let this chance slip through your fingers. Secure your spot now for a game-changing experience. Explore the details on our homepage at www.businessaesthetics.org and get set to transform your strategies.
Welcome to another captivating installment of the Business of Aesthetics podcast. I'm Ryan Davies, your co-host at the heart of the Business of Aesthetics community and podcast. And before we immerse ourselves in the riches of today's episode, I want to express my profound gratitude to all of you, our incredible listeners from across the United States and all corners of the globe. It's your willingness to embrace and share this podcast and your invaluable insights and experiences that have transformed our community into a thriving epicenter of wisdom and innovation. And your unwavering dedication is the cornerstone of our success. We cannot thank you enough. Today, we're going to dive right into our main topic. It's a really exciting one: weight management medications in an aesthetic practice. And joining me today to have this conversation is a true expert in the field, Dr. Jonathan Kaplan. Dr. Kaplan, thanks so much for being here.
Thanks for having me.
Can't wait to kind of dive into this. A little bit about Dr. Kaplan for our listeners. He's a board-certified plastic surgeon currently residing in San Francisco and has established himself as a prominent figure in the field of plastic surgery. His journey into the world of plastic surgery began at the age of 16 when he witnessed a plastic surgeon in his hometown skillfully address a skin cancer removal case, and led to his passion for the field. I absolutely love those, right place, right time, or just those stories where sometimes fate finds us to really drive good in the world. And I think that's what's a case here with Dr. Kaplan. After completing his plastic surgery fellowship at the renowned Cleveland Clinic, where he was trained by the same team responsible for the first U.S. face transplant, Dr. Kaplan practiced in Baton Rouge, Louisiana for 6 years and built a thriving cosmetic practice encompassing a broad spectrum of procedures from facial and body cosmetic surgery, cosmetic medicine, injectables, Botox, fillers, and has really built an incredible career since then, including his patient-centered care and transparency commitment leading to Build My Bod Health. So I think that's a good intro, but I have a feeling I've got some gaps to fill there because when you have a renowned career and a polished resume like yours, there's a lot to go through. So is there any gaps there I can fill in? Tell us a little bit about yourself and your services.
Yeah, after being in practice in Baton Rouge for 6 years, I was an employed physician, and I was looking to have my own operating room because I was doing more cosmetics or I wanted to move in that direction. And since I was an employed physician, the hospital wasn't necessarily going to build me my own operating room, which is understandable. So I started to look around, and I found an opportunity in San Francisco where a plastic surgeon who had his own operating room was retiring. And so my wife and I moved out here 10 years ago, took over an existing practice. That doctor retired after about 4.5 months, which was the plan. And so now it's all mine, including all the bills. But it is convenient to have my own accredited operating room, so I don't have to run around the city going to different hospitals or do anything. I can walk to work. I can operate in the morning in our accredited operating room, do injectables, and then also do our weight management program, which we can talk about in a few minutes. But I should clarify that I wouldn't say that I'm an expert in weight management. I'm definitely doing a lot in weight management. I'm learning a lot in weight management. There's so much new research coming out all the time, phase 3 trials that are getting, and then FDA approved drugs coming out. So even though I don't have an obesity medicine fellowship or anything like that, all of the things that are coming out new, I'm learning at the same time as all the obesity medicine trained doctors. So I do want to be careful to say I'm not an expert, but I feel very knowledgeable about it, and my knowledge is growing all the time.
That's a fantastic way of putting it. And I think, with any growing field where there is a massive interest in it, there's always new information coming out. And, it's people like you who can help pick up all of this information and put it into motion and explain it to people. So I think with that, it's a great way to maybe lead into that. If you could briefly explain what weight management medications are and kind of how they differ from other weight loss approaches.
And I'll start with how I got into this. So about 2
Perfect.
years ago, we noticed we had a lot of patients coming in for surgery for body contour procedures like tummy tucks, liposuction, but their BMI, their body mass index, was a little too high. And so patients who are too overweight for certain operations, that increases their risk of giving DVTs and other postoperative complications. So you don't necessarily want to operate on anybody that comes in that may be too overweight, because patients were coming in thinking that these body contouring operations like tummy tucks were really weight loss operations. And that's not what they are. They really are, just like I said, body contouring procedures where you're trying to contour the body. You're not trying to help them lose weight. The weight loss comes from the bariatric surgery or diet and exercise or the weight loss medication. So when we got into this about 2 years ago, we noticed people coming in with BMI that was a little too high. Our nurse and nurse practitioners suggest, rather than just turning these people away, why don't we start a weight management program to help them lose weight? Then maybe they'll have excess skin once they get to their goal weight, and then they might need a tummy tuck, or they'll just lose weight, and that's great too. We've contributed to the reduction of obesity in America. So we started a weight management program, and at that time, we mostly had access to things like phentermine, which are older weight loss drugs that make people a little bit jumpy. They're almost an amphetamine in a way, but not technically. And so they do help people lose weight. They are legal, but they're only considered on label for about 3 months. So the weight loss medication field was lacking when we started about 2 years ago. And then about a year ago, things really took off because people started to hear about these new weight loss drugs like Ozempic and Wegovy. They had been out for a few years. Like Ozempic's been out since 2017. Wegovy has been out since 2021. But these medications hadn't really caught on yet until these celebrities started using it and everybody started
Right.
hearing about them. And it's these are new drugs, but in an old class of medications. So they're part of this class of medications called GLP-1 receptor agonist, which is GLP-1 is a glucagon-like peptide. These are naturally occurring hormones that your body, your intestines release once you eat. And when they release these hormones, it makes you feel full. But because of a high glucose diet or high carbohydrate diet that we have in America, different body weight thermostats, if you will, kind of get a little bit off kilter. And so that feeling of fullness doesn't happen until you've eaten a lot. And so that's what these medications do, is they kind of help reset that body set weight so you feel full sooner. So again, these are hormones that the body normally releases when you eat to make you feel full, but you might not feel full because of our diet and things like that. So these medications mimic those hormones. So it makes you feel like you're full sooner. And again, this whole class of medications was originally designed for type 2 diabetes. The first one that came on the market was Byetta in 2005. So these are not new. This is not a new class of drugs, just some of the medications you might be hearing about for the first time. Anyway, they're originally designed for type 2 diabetes to help your body enhance secretion of insulin from the pancreas. That helps you with your type 2 diabetes. When you have too high a sugar in your bloodstream, it's not getting into the tissues. But then that stimulation of insulin also helps you feel full. The mimicking of those naturally occurring hormones also make you feel full. So all those combined effects of making you feel full, you eat less, you lose weight. And that's what these weight loss medications are doing now, is people are having these amazing weight loss results with drugs that have been a class of drugs that have been around for a while. So we know about the side effects, which we'll talk about. But the point being is that even though I believe in COVID vaccines and I've taken my COVID vaccines, they haven't been out that long. This class of medications has been out even longer. So we know more about them.
Perfect. I think that's exactly, like you said, it's kind of a nice thing that just happened there with the I guess the acceptance rate, sort of the awareness came up over a gradual period of time. They were in the market, and now they've kind of come forward a little bit more, and now they've reached into aesthetics practices. So what are kind of those common reasons why people turn to weight management in an aesthetics practice now, as opposed to other traditional ways that you're finding?
Well, I think most of it is that they are looking for access to these medications. And so we happen to be, so it's not really specific to aesthetics, but there's some aspects of that. But I think the reason that we really have gotten busy with this is because patients are looking for the medications because they're on an FDA shortage list. So just to reiterate, Ozempic, GLP-1 receptor agonist, originally designed for type 2 diabetes, but also helps you lose weight. The company that makes it, Novo Nordisk, realized it was helping people lose weight. So from Ozempic in 2017, they got it approved, the same exact active ingredient, semaglutide, they got it reapproved for weight loss in 2021 under the name Wegovy. And then the other drug that people hear about is made by Eli Lilly, Mounjaro, again, designed for type 2 diabetes, approved in 2022. And by the end of 2023, Eli Lilly will have that also approved for weight loss. But since these medications are so effective and they help you lose weight, they're on an FDA shortage list, an official shortage list. And I've done a graphic that I can actually provide you for the show notes that shows that the reason they're on the FDA shortage list is if you compare the COVID vaccine to these medications, the COVID vaccine, when they first came out with it, there was a shortage. They couldn't get it out to the 330 million Americans that were candidates for it. And there was still, in light of that, there was COVID vaccine hesitancy. Not everybody wanted it, and they still had trouble keeping up the demand. Well, compare that to a medication vaccine that's only once per year. Compare that to these weight loss medications that we're talking about, Ozempic, Wegovy, and Mounjaro, that are once per week injections. People wish they were oral. They're oral medications. Eventually, we will, but these are once per week injections. And so, if you take to account that nobody's got weight loss shot hesitancy, like they did it with the COVID shot, and you take into account that there are 42% of Americans are considered obese, and that these people are candidates to take this shot once per week for a year, for example, you can actually take them indefinitely, but let's just say, for example, they take it for a year. That means that the drug companies would have to come up with 7.2 billion syringes per year to take care of the existing candidates for these medications. So 7.2 billion with a B. So because there's a shortage, not everybody can get access to it. You can't find the name brand drug at the pharmacy. And even if you can find the name brand drug, you can't necessarily find the dosage you want because the dosage goes up each month to minimize GI side effects. So because they're on FDA shortage list, that means compounding pharmacies are legally allowed to make an exact duplicate of the active ingredient found in these name brand drugs. So if you're out there looking for these drugs, and there's 5 obstacles you're going to run into looking for these medications. First, you have to go to a doctor that'll write you the prescription. Well, a lot of doctors still don't think of obesity as a chronic condition like diabetes or high blood pressure. They think of it as a lack of willpower that you need to just, really dig in to diet and exercise. So that's the first problem, is the doctors don't want to write you a prescription.
Right.
Okay, let's say the doctor writes you the prescription. Okay, the second obstacle you come to is that insurance doesn't want to cover it because these medications are expensive. It's about $1,000 to $1,300 per month for any of these medications I've mentioned, Ozempic, Wegovy, or Mounjaro. So your insurance might not cover it. Okay, let's say your insurance does cover it. Then it brings you to the third obstacle, that then you have to find a pharmacy that has it in stock because, as I mentioned, it's on a shortage list. Then let's say you find the pharmacy that has the medication in stock. Well, then you come to the fourth obstacle, that the pharmacy doesn't have the dosage you want. Again, they start at a low dose to get you acclimated to it, and it goes up each month. Okay, then let's say the pharmacy has the dosage you need. Then you come to the fifth obstacle, that by then that they have your dosage. The fifth obstacle is that the insurance company who approved it, after about 3 months, they then require you to get another pre-authorization for it, and then they deny you. So it's very crazy game that the insurance companies are playing. I've heard it from all of our patients. And for example, we're in California. If you're a Kaiser patient, they won't even write you a prescription. They don't want to cover it. So that's the reason people are getting to us. An aesthetic practice, yes, by chance, but patients are just looking for these medications anywhere they can get it. And because we get it from a compounding pharmacy, we have a large supply of it, of both semaglutide, the active ingredient found in Ozempic and Wegovy, and tirzepatide, the active ingredient found in Mounjaro. So that's why they're coming to us. But it is natural for it to be in an aesthetic practice, as you mentioned, because as a plastic surgeon, we do body contouring operations. Not everybody's a candidate for those operations. And so we can help them lose weight before they do that operation.
I feel like with that kind of a journey, you probably have about as good a chance of playing a Powerball ticket and hitting everything as it is to go through and get everything to work out exactly through that way. So it just makes sense for why people are turning to aesthetics practices. And that you touched on it there. I think this is a great kind of segue into that. Is, you know, who are the people? What criteria should someone meet before considering these medications as part of their weight loss journey? And who are the ideal patients that you're finding, are reaching out for this?
Right. So, yeah, so the patients are technically, according to the FDA and the prescribing medication for Wegovy, the one that's officially approved for weight loss, the parameters are that you have to have a BMI of greater than 27. And if you're not sure how to check your BMI, go online and go to BMI calculator. Just Google BMI calculator. It'll ask you to put in your weight and your height, and that's how you'll figure out your body mass index. But a BMI of greater than 27 with an obesity-related condition like diabetes, high blood pressure, high cholesterol, sleep apnea, then you're considered a candidate. And why that's important is that if you're considered a candidate based on those BMI parameters, then you're more likely to have insurance to cover it, even though statistically they're unlikely to cover it. That's why that's important. Or a BMI of greater than 30 without those obesity-related conditions. So basically, if you're considered what's considered obese, then you are a candidate for these medications, and you can get it prescribed to you on label and possibly insurance cover it. Now, if you don't meet those BMI parameters, like you're less than 27, then you can still take the medication. Your doctor can still prescribe it. It's just considered off label. Doesn't make it illegal. It's totally fine. And so we have found that after providing these medications for almost a year now, that we have over 400 patients currently in our program, that we can see that the benefits far outweigh the risks. So even if somebody was like, if there was like a high percentage of people getting pancreatitis, then you'd really only want to stick to the people that met the parameters. But the risk of pancreatitis, knock on wood, we haven't seen it once in our practice after even 400 or 500 patients. So it is very low. It is something that is known, but it's very low risk. So if the risk is so low, then I am comfortable prescribing this to patients who are less than the BMI of 27. And the reason I would prescribe to somebody less than a BMI of 27, I'll give you a couple examples. Maybe it's a patient of mine that I did liposuction on, and their contours still look good, but they've regained some weight. And so in the past, we would just offer them liposuction again. Well, liposuction, a second round, has its risks. I mean, there's scar tissue there and things like that, pain, all kinds of things like that. But if you have these great weight loss medications and your BMI is 26, well, I feel like the benefit of providing them the medication outweighs the risk. And I feel like the risk of maybe doing a second liposuction procedure and the fact that liposuction is more expensive, that those are good candidates to provide these medications to, because you can help them lose the weight again. They still have their good contours from the previous liposuction, but they might be less than a BMI of 27. Another example is somebody that I've done a tummy tuck on. They still have good looking contours, but they have a lot of visceral fat, meaning the fat that's on the inside around your intestines. You can't remove that surgically. That's only lost, that visceral fat, that basically pot belly look. You can only get rid of that with diet and exercise or medications. And so that person might be less than a BMI of 27, and they're also a really good candidate for these medications, even though it's considered off-label, not illegal. So that's technically who can and who cannot be on the medication. But another reason a lot of people are seeking us out is because we get the medications from a compounding pharmacy, which again is legally required. If they're making a duplicate, it's legally required for it to be an actual duplicate of the name brand. It can't just be some like quasi knockoff. But the compounded versions are less expensive than the name brand if you're paying out of pocket. So that's another benefit to our patients. And I can share the pricing.
Sorry?
And I can share the pricing if that's
sure. Yeah, absolutely. Yeah.
So, for example, if you're talking about Ozempic, Wegovy, or Mounjaro, weight loss drugs name brand, they're $1,000 to $1,300 per month. With the compounded versions, what we provide is it's $500 for semaglutide, which is the active ingredient of Ozempic, Wegovy, or tirzepatide, which is the active ingredient of Mounjaro, and that's $600 a month. So basically, patients go on to our website and they sign up for essentially like a Netflix subscription. They put in their credit card, and then they're automatically charged either $500 or $600 depending on the medication. And we can go into which is better, semaglutide or tirzepatide. But they sign up and then they're charged automatically $500 or $600 each month. And then we ship them the medications. It's 4 pre-filled syringes because, again, these are once per week injections. And so that's not cheap. I'm not saying it's cheap, but it's significantly less than the name brand drugs, obviously. And we did find out with some data from our patients, we asked them to look at their Uber Eats accounts, their DoorDash accounts, their Instacart accounts, and compare the amount that they spent on food before and after the medication. And they totally saved money on the medication. So some of those savings from, excuse me, they totally saved money on their food. So the savings
Right.
from the cost savings of food, they can apply that to their monthly medication cost.
And ROI even in health as well. Hey, like, I mean, it just totally
That's
makes sense.
true.
Like you said, you're getting it from somewhere, but saving it somewhere else, which is great. You mentioned before a little bit at the beginning of our of that conversation there. Some of the benefits and risks. You were talking more about the liposuction, like how you talk about that. But how about with the with the actual weight management medications that you're
Absolutely.
working with as well? Some of the benefits and risks of those.
Yeah, and so that's what we always go over with our consultations. We never want to gloss over that, especially because people see things on the news, like they hear stomach paralysis or they hear people, their intestines stop working. So I'm not minimizing those risks, but I want to clarify to everybody out there that even though the news brings this out as though it's new, again, this class of medications has been around for over 20 years. We know about all these risks. We are very, very familiar with them. But I will tell you that the news will give them a name that sounds more clickbaity and more scandalous and incendiary than what the typical terms are. So, for example, when they talk about stomach paralysis, that's something called delayed gastric emptying, which I know sounds like a euphemism, but it's the same thing. So, just to clarify, all of these side effects are really all related to how these medications help you lose weight. So, one way they help you lose weight, as I just mentioned, is delayed gastric emptying, also called gastroparesis, also called stomach paralysis, although I wouldn't use those terms because they're so scary sounding. But delayed gastric emptying is one of the ways they help you lose weight. What that means is the food moves more slowly from your stomach to your intestine. You feel more full, you eat less, you lose weight. But that feeling of fullness can lead to burping, bloating, abdominal pain, nausea, vomiting, and slow down the lower GI tract in the form of ileus, which is just a fancy term for a slowed down bowel or intestines. The peristalsis doesn't work as normally, so you can experience constipation, but it can be the opposite. It can also cause diarrhea. The diarrhea is bad enough. It can lead to dehydration, which could affect your kidneys, but that's usually people with pre-existing kidney disease, and the best way to avoid that is just drink lots of fluids. The other way that these medications help you lose weight, and the reason they were originally designed for type 2 diabetes, is they stimulate the pancreas to release insulin, which helps with type 2 diabetes. But that stimulation of insulin also makes you feel full, so you eat less, you lose weight. But because it stimulates the pancreas, that can lead to inflammation of the pancreas called pancreatitis, which is very rare, but it can happen. And so that's something we watch for with our patients. And the other thing that people hear about on the news is medullary thyroid cancer, which obviously sounds scary. But that was something that was first noted in lab rats when they were studying it in the lab, studying these drugs in the lab. And they found that some of the lab rats developed a rare form of thyroid cancer called medullary thyroid cancer. But they even noticed that some of the lab rats that were taking a placebo, that weren't even taking the active ingredient as part of the control group, that even some of them developed medullary thyroid cancer. So it wasn't really clear what the significance was. And even the FDA says it's not clear what that's how that really applies to humans, because again, as even though the medications have been around for over 20 years for human use, medullary thyroid cancer in humans has remained rare and unchanged for over 30 years. So we haven't seen a spike in medullary thyroid cancer in humans. So it doesn't seem to be really an issue, but certainly encourage people to check their neck once a month, make sure there's no new lumps or bumps that weren't there the month before. So we are aware of these side effects. Some people talk about alopecia or hair loss. That's not really specific to these medications. What that is that anytime you have a stressor, including weight loss, there's something called telogen effluvium. It's a fancy term for some hair loss that's due to a stressor, including weight loss. And so when they looked at Wegovy, which is the semaglutide, the one that's approved for weight loss, when they looked at that in the FDA's approval paperwork, they found that patients had some hair loss at 3% of the time, but patients who were on the placebo that weren't taking the active ingredient, they had some hair loss 1% of the time. So go figure. And I'm not saying that people are going bald. It's mostly that you notice some hair loss. Not everybody does, but it only happened in 3% of the people. So there are side effects out there that you might hear about. You might think it's a new side effect, but it's something that we're very much aware of. In fact, I haven't heard the news come out with any new side effect that we didn't already know about. I think that's really important to know. But so those are some bad side effects I talked about. Let's talk about some good side effects. Aside from weight loss, We don't understand why, but this also leads to a reduction in craving of smoking, vaping, alcohol, carbonated drinks, reduces your tendency to want to bite your nails or online shopping. So this medication, it reduces all of your vices potentially, or any OCD tendencies you have. This can reduce those. It's really amazing, and they don't understand those anecdotal reasons of why that happens. They have a pretty good understanding of why it reduces weight because of suppression of appetite in your hypothalamus, delayed gastric emptying, stimulation of insulin, but all those other good side effects, they're not exactly sure why that happens yet.
That's incredible. Yeah, there's so much more than just under the surface, and of course, like you said, there's lots of clickbait and lots of generating, traffic to websites or conversation around it. But the history behind this, that there is a long history, really kind of speaks for itself. And we talk about, like we just said, the benefits and risks. Well, there's certainly a risk to not managing your weight that may be far beyond anything else, right? So there's
Thank you very
certainly
much.
Given the history and the track record here, it's incredibly encouraging and positive. But with that, I mean, we want to talk about, you mentioned as well, this is part of a comprehensive approach, right? It is something that is part of your overall health, that it is something you have to, really, it, like you said, it's just one element of it, but it's a very key element. And the role of medical supervision in that as well comes to play, right? So
Absolutely.
speak to our audience a little bit about that, about how this fits in the overall health picture, and then how medical supervision really helps monitoring that you're on the right track and doing all the right things.
So what we offer all of our patients, they don't all necessarily take us up on it, but what we do with all of our patients after the consultation is offer them a coaching versus a non-coaching program. And the coaching program is with our nurse practitioner, where they can meet with her in person or virtually up to once per week for 6 months on coaching on diet and exercise, with the idea being that once these medications help you get to your goal weight, if you choose to get off of them, although you don't have to, you can actually take them indefinitely, that if you choose to get off of them, that coaching, behavioral changes on coaching on diet and exercise will help you maintain that weight. So we do offer that to patients. It's a 6-month program. That doesn't mean they're locked into the medications for 6 months. The medications are always month to month. You can always switch from semaglutide to tirzepatide, stop anytime. But we absolutely offer them coaching on diet and exercise. As far as diets go, we really try to find a diet for them. There's not one specific one that we always recommend, but we're looking whatever one that they can maintain, whether it's a keto diet or intermittent fasting. Those are all things that we go over in the coaching program. If they choose not to do the coaching program, okay, then there's no coaching. But at the very least, we do get lab work on everybody to just determine their baseline lab work. And even though the labs, and I'll go through this, they don't necessarily preclude you from taking the medication, but we just want to get baseline lab work if there's something that you don't know about that you need to get worked up by your primary care doctor. So for example, we get a CBC, which we're checking for anemia. That doesn't keep you from taking these medications, but you need to find out why you're anemic if you didn't already know that. We also get a complete metabolic profile, which looks at your liver and your kidneys. Well, these medications aren't metabolized by your liver or your kidneys, so that doesn't preclude you from the medication. But you need to know if you're having liver or kidney issues that you might not be aware of. Now, you may have a fatty liver, which isn't not always clear how that's clinically significant with every patient. But I have read in some recent studies that tirzepatide, the active ingredient Mounjaro, is actually maybe better for a fatty liver than semaglutide. So that might be a reason somebody would take that one over semaglutide, if they're not so much worried about the price point. The other lab test we get is a hemoglobin A1C, which takes a snapshot of your sugars over the last 3 months. Well, if that's high, if that's abnormally high, well, these medications originally designed for type 2 diabetes are actually the right treatment for that. So that wouldn't certainly preclude you from the medication. And then the fourth test we get, lab test, is looking at your thyroid. And this isn't to check to see if you have medullary thyroid cancer or not. That's something that's very much a genetic inherited thing. That's something you would know about already. You're not going to find that out from a lab test. But we're looking to see if you're hypothyroid, meaning you're not producing enough thyroid hormone, which would lead you to being overweight also. So that's something you need to get worked up to if you need to be on thyroid supplement, that can also contribute to helping you with some weight loss. So those are the reasons we get those labs, even though they don't necessarily keep you from, they don't opt you in or out of the medication, but it's something you should be very much aware of. But we do encourage patients to do the coaching program because we feel like that's going to give you better long-term results. And just like you said, as far as, your health and the things that you might be worried about with these medications, that your your likelihood of dying from heart disease and type 2
Right.
diabetes and high blood pressure by not taking these medications is much higher than your risk of dying from medullary thyroid cancer by taking the medications.
That's I mean that's just a great point to point out about that. One of the things that you touched on a little bit. There are lots of myths about this. I hate to use the term favorite, but what are some of the favorites that you've heard where you're just like, no, that's not how that works, and or just that you're constantly debunking, but is helping
Right.
people's mind at ease, if you will.
Yeah, I think the most common one is that people will say that they will have less gastrointestinal side. Okay, I look back up, as I mentioned, these are once per week injections. You can do it
Right.
in the abdomen or the thigh or wherever. People believe or think that they can get fewer gastrointestinal side effects if they do the injection in their thigh rather than their abdomen. And these medications are mimicking hormones which act all over the body. So it doesn't matter where you make that injection. Now, if somebody believes they have fewer gastrointestinal side effects by injecting the thigh, then so be it. If there's a placebo effect, I'm not going to discourage it. But if somebody's asking me before they've started, hey, I heard that I'll get fewer GI side effects by injecting my thigh, then there's no evidence of that whatsoever. So that's one of my favorites that people think that will be the case.
Uh,
Um, uh,
Go
Go
ahead.
ahead.
Yeah, keep going. I love hearing more of these. This is great.
The other one that I do hear is people will say, "Oh, well, rather than me starting at the low dose, um, and I'd rather start at the highest dose so that I can lose more weight faster." And they don't really understand that that's not the way the medications work. It's not like we're holding on to the higher doses so you lose more weight at a later time. The reason they figured this out through multiple phases of the trial studies that they've done is that these medications can again give you these GI side effects. And what they found is by starting people at a lower dose, that the GI side effects were fewer and far between, and that allowed people's body to acclimate as they went to a higher and higher dose. So it wasn't about the higher doses give you more weight loss, the lower doses don't. It's just easing you into it. So people will ask me if they can start at the higher dose, and I was like, no, you can't do that because you're going to be doubled over a toilet and sick. Now, if somebody was with a different provider and they were already at their max dose and they want to switch over to us, then yeah, we won't make them start over. They can go at the same level for sure. But yeah, that's a common one where they just like, let me just jump right in, doc. Let me go to the highest dose. Is like, no, you will not be happy about that. So that's why we start people at the lowest dose. And people will ask, the other common question is, well, if I stop the medication, am I going to gain all the weight back?
Right. Yeah.
Well, you're going to have to do something for the rest of your life. It's either going to be diet and exercise or the medication. So if you stop the medication and you stop diet and exercise, then yes, you will regain the weight. And they actually did a study on this where they followed patients for a year and 4 months on the medication and diet and exercise. So they had medical and behavioral interventions. And on average, over that year and 4 months, patients lost 15% of their body weight with the medication and diet and exercise. Then they took a subset of those patients and then stopped everything, stopped diet, exercise, and the medication. And over the course of a year, they regained 2/3 of their weight. So they didn't regain all their weight over the course of a year. That actually took about 5 years to do. But the other way I look at this is that nobody could reasonably expect that if you stop everything, diet, exercise, and medication, that you could continue to think that you would maintain that weight. So that's why I tell people they have to do something. And you can actually take these medications indefinitely. What we're doing for patients who get to their goal weight and they don't want to quit the medication because they're afraid their weight will go back up, we offer them a few different options. There's an oral lozenge version of semaglutide, the active ingredient of semaglutide.
Okay.
It's a lozenge. I wouldn't say we don't know yet if it will help you lose all the weight if you do that from the beginning, but it certainly seems to help people with maintaining their weight. So there's a lozenge, but that is a daily lozenge. It's not once per week. The second option is you can stay at that same dose, but take the medication instead of taking it every week. Maybe you'll notice that your appetite suppression lasts for about 10 days or 14 days with one shot. And so then you can start taking the medication less frequently each month. So you can take it maybe just 2 or 3 times a month, or the lucky few, maybe just once a month. And then the third option is you can just lower your dose. And that way you can minimize any potential for GI side effects a long term and continue taking it every week. So that's the few different maintenance options we have: is daily lozenge, fewer injections per month, lower dose every week per month. And so I'm not saying we want people to be like, medication dependent the rest of their life, but I think we're going to find the longer we see these medications that how relatively safe they are. And, taking a shot once or twice a month to keep your cardiac risk factors down, keep your visceral fat down to reduce your cardiac risk factors. I think that's a pretty good trade-off.
Absolutely. I mean, it's like, someone taking high medication for high blood pressure goes down. They change nothing in their lifestyle and they go off of it. Their blood pressure goes up, and then they're wondering what happened.
Like,
It's not a
what
cure.
happened?
It's yeah, exactly. Right. So, but I think you touched on something great there too, because again, a lot of our listeners, this is what they're looking for is this something that's right for their aesthetics practice or for what they're doing from that perspective? This is a great addition for a wellness roadmap for people and for a lifetime patient value type of an offering to your patients, right? So like when you kind of started this and onboarded it, how was your, like, did you find that this was something that helped you both, with your current patients, bring in new and segue into other areas of your practice as well, all kind of in a nice just a nice addition to the portfolio, if you will?
Absolutely. It's great for an aesthetic practice or any practice. I mean, any provider can offer these medications. But for an aesthetics practice specifically, I know, like, there's aesthetic practices out there that are marketing, for their laser hair removal, or they're marketing for their injectables. Well, this encompasses everybody. Everybody, not, even if they're not considered obese, everybody wants to lose some weight. And
Mm-hmm.
so the reason this is beneficial to your aesthetic practice, if you just provide marketing for this on social media, I wouldn't necessarily do Google AdWords because there's a lot of people advertising Google AdWords, so the keyword is kind of expensive. But but social media, putting it on your blog, email marketing to your existing patients. Everybody wants to lose a little bit of weight or a lot of weight, and so by marketing this to your existing patient base, and the fact that it works and you can track all the data, and that's what we've done is we put all the data on our website, so that just helps market patients even further, markets to patients further. They can see the data and how patients are doing so well. But then you can eliminate all those other advertising marketing channels, because this will bring all these patients in, and then they will want to do Botox, they will want to do laser hair removal, they want other services. And in my case, as a body contouring plastic surgeon, and even head and neck procedures, that after they lose the weight, they're going to want some surgical procedures as well. So I think this is appropriate for my pre-op and post-op surgical patients. It's also it doesn't require a capital investment. If we're looking at it from the aesthetic practice standpoint, you don't have to go out and, if you buy an aesthetic device, you're paying a mortgage on that every month. With these medications, it's more like Botox. You just pay for the medications as you need them from the compounding pharmacy. They ship it to your practice, and then you can provide it to your patients. So there's a big benefit in the sense that there's no capital investment. It doesn't require, like, with laser hair removal, the nurse has to be in there treating the patient for the whole hour. It's not like that. You can take care of a lot of patients at once. I mean, as a surgeon, I like the instant gratification of operating on people and giving them a result, giving them perkier breast, a flatter tummy. But there's only so many operations I can do in a month to get that instant gratification. Whereas right now, I've got over 430 patients on our weight management program, and they're all losing weight. These drugs are amazing. And so I can get instant gratification over 400 something times in a month, every month. So the monthly recurring revenue has been great, because we are able to help other practices find compounding pharmacies, so they can find out how to source these medications. So that's something we can help them with. And then they can have a healthy profit margin with these medications. It is important to know that the medications are less expensive at the lower dose. They get a little more expensive at the higher dose as far as the cost. And so what we just choose to charge the patient the same amount each month, so we don't increase the price on them. But yeah, no, there's a lot of really good benefits from a business perspective for aesthetic practices, as far as the no capital investment, the monthly recurring revenue. This is very sticky. Patients want to keep taking these medications, and most of all, they work.
I love it. And you called out, like you said, this isn't even a huge, don't undertake a huge marketing cost with it. Really build this into your SEO style. As you mentioned, people are starting on Google to learn about this. Show your expertise, show authority, show trustworthiness in this area, show people what they're looking for, answer the myths, dispel them, and bring them to your practice. Is just a great addition to what people are already doing. You've had a lot of success stories, like you said, over 400 people already. Do you have any that stand out in terms of, a success story or a patient case that stands out?
Most
in your
definitely.
experience?
Yeah,
Perfect.
we have different photos. A couple different things. We on our website and on social media, we'll post before and after photos. A lot of patients send us before and after photos, so we know like there's one patient comes to mind that lost 50.6 pounds over 3 months. We have an adolescent who's 14 years old that lost 70 pounds over 6 months, and that's totally legit as far as treating an adolescent because Wegovy, the one that's specifically approved for weight loss, also has an indication, which is the active ingredient semaglutide, which is what we offer from the compounding pharmacy, that is specifically approved in adolescents 12 to 17, and then of course adults 18 and up. So we're prescribing semaglutide on label for adolescents. And so yeah, 70-pound weight loss in an adolescent. So those are two that come to mind. The other thing that we do that's pretty cool is that when patients sign up for either the coaching or non-coaching program, we send them a journal and we send them a Bluetooth-enabled scale. So what the Bluetooth-enabled scale allows them to do is that it keeps track of all of their weigh-ins, and so they can download it to an app. And then what they do is they can see a graph on their app showing their weight loss. What they do is they take a screenshot and they send it to us to post on our social media because it doesn't have any identifying information on it.
Amazing.
So from a marketing perspective, that's been pretty fun, just day after day showing these weight loss trends of all these people losing weight and just looking at their graph from their weight loss, whether it was over 3 months, 5 months, or 6 months, whatever it is. But the proof is there, because that was the thing that people were asking initially. It was like, well, you're getting it from a compounding pharmacy. How do you know it's legit? How do you know it's the real thing? Well, so first off, the compounding pharmacies here in the U.S. that have licenses here that are getting it from manufacturers that are FDA approved manufacturers that follow current good manufacturing practices. And we're able to get a certificate of analysis showing that what we're getting is the actual semaglutide or tirzepatide. So our entire supply chain is like legit. We're not getting this overseas or anything weird. And so we know what we're getting, but I tell patients, like, don't believe me. Don't take my word for it that what we're getting is the same thing as the active ingredient Ozempic, Wegovy, and Mounjaro. If you take the medication, you're going to notice almost immediately the food noise goes away. You stop thinking about food. You stop thinking about your next meal, what you're going to eat. And you also start to see weight loss. That's not sugar water we're providing you then. This is obviously the active ingredient in those medications from the compounding pharmacy. Because if it works like that, it must be the real deal. And it is.
Absolutely. And that's just fantastic. And I mean, what a win-win-win, like you said. The patient wins because they're seeing their results. You win because you're able to share in that success and be able to attract more people to it. And then those people win by seeing the legitimacy of how you can change their lives too. So I think a great place to kind of close off before we kind of learn a little bit more about you is just, in your opinion, what do you think the future holds for weight management medications in both the aesthetic space and in overall healthcare?
So I think every provider in America should be providing these medications, including aesthetics, because they just work. Patients need access to it. Again, as I mentioned, those 5 obstacles. So the route we're going is compounding pharmacies. Now, as I mentioned, the reason we're able to get it from a compounding pharmacy is because these are on the FDA shortage list. So the idea is, what if they go off the FDA shortage list? Then the compounding pharmacies won't be allowed to make anymore. That goes back to my original stat about 7.2 billion syringes. I don't think they'll ever be able to catch up with demand. Even the CEO of Novo Nordisk that makes Ozempic and Wegovy, even he said on CNN in September that they don't think they'll be able to meet the demand for several years. So I don't see these coming off the FDA shortage list. God forbid the FDA changes some rule, though. Anyway, so I think every doctor can get access to this. I think you make it much easier for your patient if you can get it from a compounding pharmacy, because you can provide it to them. They don't have to go track down a traditional pharmacy that has the medication or has the dose. So it's a patient satisfied. You're providing better customer service to your patient. If you make it available for them to purchase online and then they're automatically charged each month, we can help you figure out how to do that, to set it up like a subscription. Since we've had experience with our practice, we can help providers out there figure out how to do that. We can help you with finding the compounding pharmacies that source it in your state. So I think this will be around for a long time. I think all providers will be doing it. I think there will always be a different medication that's coming onto the shortage list. So for example, these are great medications that work awesome right now, but there's multiple medications in the pipeline. Eli Lilly's got one called orforglipron that is, and just finished, I think, phase 3 trials. That is a daily oral medication that works as well as the injectable. Because it's not a protein base, and so it doesn't get degraded in the stomach as easily. And so that's a daily pill that has same incredible weight loss results as the weekly injections. So that's one pill that's coming out. Amgen is coming out with another medication that's actually going to be a once per month injection.
Wow.
So this is incredible field. And as it goes back to the fact that, yes, I know I'm not an obesity medicine specialist, but there's so much new data coming out that I'm learning that at the same time as the obesity medicine specialist. So I'm just, gaining as much knowledge as possible. But so anyway, the pipeline of these new weight loss medications, we've unlocked this amazing drug. I mean, the only drugs I can think of that are as good are Botox and Viagra, and then these medications. And then the next thing after this medication will be one for hair loss. That'll be huge whenever they figure that out. But I can't think of other medications that are as effective for lifestyle as these medications. They're really incredible. So that's what I see coming down the pipeline, is these new medications that are oral or monthly that work as well or even better and have some prolonged weight loss effects.
It's funny because, again, you listen to the media, you hear about it, it almost sounds like this is at its peak already. And then now listening to you, we are literally scratching the surface of where this is going to go in sort of in terms of that mainstream acceptance and pickup. And like you said, it's going to continue to expand. So
it's true.
This has been absolutely an incredible kind of journey through this, and a great introduction really to it, because it's just scratching the surface, like we said. But if people want to learn more about you, about Build My Bod, about anything to do in this space, where can they find out more and contact you?
I think the easiest way is just to email me, or so there's a couple different ways. This will make sense if you let me explain that. On social media, I'm Real Dr. Bay, RealDrBae, not BAY, because I'm in the San Francisco Bay Area. So I'm Real Dr. Bay on Instagram, Snapchat, TikTok, and I think Facebook too. So people can direct message me through Instagram at Real Dr. Bay, RealDrBae. They can also email me, but the website they can go to also is realdrbay.com. They can message through the website, but also they can email me at Dr. Kaplan, DrKaplan at PH as in Pacific Heights -PS as in plasticsurgery.com. Dr. Kaplan at ph-ps.com. They can ask me any questions they want. We do have this separate company that helps with the subscriptions and the compounding pharmacy, and basically helping with consulting as far as offering you a turnkey weight management solution. That email is jonathan@buildmybod.com. So any of those ways, people can absolutely get in touch with me.
That is incredible. Again, I tell everybody, take advantage of those offers. When someone says reach out, get in touch, learn more, and help grow your business and help with Dr. Kaplan as well. I want to thank you so much, Real Dr. Bay, Dr. Jonathan Kaplan, for joining us today and discussing your journey with us into the world of the ever-growing world of weight management medications and bring them to an aesthetics practice. Thank you so much.
No, thanks so much for having me. Enjoyed it.
Wonderful. And I want to thank our listeners as well. We appreciate every one of you. We can only do what we do with you. So if you like our podcast, please kindly share it with your friends and on social media. And don't forget to rate a review on iTunes or Google Play. Your thoughts will help other doctors and practice owners find us. So until we meet again, I wish you all an amazing week ahead. Thank you so much. Thank you again, Dr. Kaplan. And thanks, everybody. Take care out there.
Thank you for joining us this week on the Business of Aesthetics podcast series, brought to you by our gold sponsors, MRP, Laser Uptech, and Equa Marketing, and silver sponsors, Lengia Law, Eilis Works, and Pronox. Would you like to join our growing group of aesthetic industry experts and get featured on the Business of Aesthetics podcast? Or do you know someone who would love to share their strategies for growth in the aesthetics business, providing quality patient care, or their clinical expertise? Head on over to www.businessofaesthetics.org/podcast-show and apply to be featured as a guest on the show. Remember to subscribe to this podcast on iTunes, Google Play, Amazon Music, or wherever you listen. If you would like to engage with today's or any of our past speakers, join our Facebook group or LinkedIn group by searching for Business of Aesthetics. Thank you and have a great day.